Hi, my name is Charbel Yunus, and this is my submission for Nursing 629 of Advanced Health Promotion Diseases. I decided to do my project in a binder, and this is my title, Health Promotion of Various Aging Populations. And this is my pocketbook. As you can see here, I have a table of contents page with a bunch of different labels, chapters, and page numbers on the different topics. And I have 12 for 12 different entries. Here, to begin with, is my interventions for health promotion and disease prevention at primordial, primary, secondary, tertiary, and quaternary preventions, just the definition and examples of each. The next page is health promotion and adult care. I have screening tests, specific history questions for adults, lifestyle assessments, nutrition, and screenings for weight and obesity. Because as we talked previously in class, that nutrition and obesity is an important thing to talk about in today's society in America. Different screenings for cancer, cervical, colon, breast, lung, prostate, STDs. Diabetic screening, eye exams, hepatitis, and counseling and education, nutrition, exercise, tobacco, alcohol. A list of different immunizations, when to take them, when to not take them, preventive medicine, and risk factors of depression for adult health. I have a little mnemonic called SAD Persons here to help me identify the different risk factors for depression and adult health. Especially in today with COVID, I feel like adult health and mental health is really important right now. This is my section on health promotion of the well elder care, characteristics of today's old population, aging, components of a well elder, evaluations such as fall risk, dementia, delirium, vision, hearing, mood, cognition, infections. This is a typical presentation here, and I have examples of what to look out for. Risk factors of falls, assessment skills, driving history, predictors of motor vehicle accidents, and cognition exams. Depression findings, and nutrition considerations and continent issue care, and what to do with patients that are dealing with incontinence and complications that can lead to incontinence. Here I have maternity, trimester, and pregnancy, and I have the physical changes, internal diet of each trimester, and how to diagnose pregnancy through presumptive, probable, and positive signs. Here I have a chart of hypertensive disorders, such as gestational and preeclampsia, as it's important to realize when a patient is about to go into the preeclampsia stage, because you don't want them to experience seizures, and preconceptual counseling. Nutrition in pregnancy, stages, Nagel's rule, breastfeeding advantages and disadvantages. Here I just have a little list of vaccines acceptable during pregnancy. So far, I understand that flu vaccine, IM, and Tdap can be given during pregnancy. This is just a section on postpartum care. I have postpartum lochia. I just have a little diagram explaining of what to expect and when to expect it. And postpartum uterine atony, risk factors, features, and interventions. This is a little picture of understanding postpartum hemorrhage. This is about the fetal well-being. I have different tests, Doppler, the LS ratio, the indirect combs, abnormal results, what to understand from them, what to look out. I have a little diagram. This has a loan, has the different examinations to look at for fetal well-being, and a little blurb of how to follow up for each one, and also my APGAR chart. Here I have a chart on understanding neonatal abstinence syndrome, treatment, what to look out for, and also how to prevent SIDS. Here's my health promotion of the excuse me, of the well woman care. I have internal genitalia exam, external, when to do pap smears, HPV prevention, Gardasil vaccine, Cervarix vaccine, the risk factors of HPV and the vaccines as well. Here are breast cancer screenings, what to look out for in lumps, how to treat, how to go about it with tests such as Doppler, ultrasound, and mammograms with the different categories to look out here of the BI-RADS. So just understand what to recommend and what to look out for each category. And just patient education on genetics. Here starts my pediatric section. I have the health promotion of infant and the developmental milestones, as this is really important, I feel like, understanding to really understand the well-being of the child. Schedule, nutrition, nutritional timeline, 4 to 6 months of solids, introduce some solids, especially iron fortified foods, newborn assessments, APGAR again with scoring, postnatal history, examinations. Here I have infant reflexes, the months to look out for them, and SIDS again, and elimination. A little diagram of understanding intracranial pressure. Toddler age care, and also the developmental milestones, social, psychosocial, and all the diet and toilet training. This is preschooler age care, also developmental milestones, physical and understanding growth, what to look out for growth in this age population. School age care, looking at cognitive development, and the children's beliefs about death, because I feel like this is important to understand, especially when you're dealing with a patient of that age experiencing death. I feel like it's not taught enough in school, so I included a chart of how to understand it. Heimlich maneuver. Adolescent stage care. Here I talk about growth, when growth stops, sexual maturation sequence of male females. I also talk about body image disorders, body nutrition, which usually eating disorders happen, anorexia, bulimia, when to look out for those, since body image and social media is such a big part of this population nowadays. And suicidal ideations, and understanding that this patient group usually thinks that they're invincible, and to educate that, repercussions, and just trying to promote safety for this age group. But that was my pocketbook. I really enjoyed it. I learned a lot, and I think this is going to be really useful in my practice as a family nurse practitioner dealing with all these different populations. So I thank you again for giving me the opportunity to put together a very helpful project for myself in my future practice, and I hope you have an amazing day. Thank you.